Knowledge of cutting planes of the human body is essential for the ultrasonographer. In this course, we give preference to the use of the terms sagittal, transverse, and frontal. The transducer is equipped with an indicator. The monitor displays an icon on the screen indicating the orientation of the transducer. This icon may be displayed either to the right or to the left side of the screen. In the sagittal plane, combining 2 by 2 the positions of the indicators of the transducer and of the monitor give 4 possibilities. Cardiologists historically choose directing the transducer indicator towards the head and the monitor indicator towards the right of the screen. Radiologists historically choose to direct the transducer indicator towards the head and the monitor indicator towards the left of the screen. The images obtained by radiologists and cardiologists are mirroring one another in the sagittal plane. The radiologist is looking at the section from the right side of the patient and the cardiologist from the left. In the transverse plane, combining 2 by 2 the positions of the indicators of the transducer and of the monitor give 4 possibilities. Cardiologists historically choose to direct the transducer indicator towards the left side of the patient and the monitor indicator towards the right of the screen. Radiologists historically choose to direct the transducer indicator towards the right side of the patient and the monitor indicator towards the left of the screen. In transverse view, the images obtained by radiologists and cardiologists are similar. Both radiologists and cardiologists look at the section from the feet of the patient. To avoid changing the position of the indicator on the screen, intensivists and emergency physicians may choose cardiologist convention. This makes sense as heart anatomy is more complex than anatomy of other organs. This choice may, however, disrupt the radiologist when you show him the sagittal views. This convention is easy to remember. The indicator on the monitor is always positioned at the right of the screen. In sagittal plane, transducer indicator is pointed towards the head. In transverse plane, transducer indicator is directed towards the left of the patient. Transducer manipulation can be broken into 5 basic movements: sliding, rotating, tilting, rocking, and compressing. Sliding the transducer on the body allows you to find the best window or to move to a different area. This image illustrates the movement of sliding from the location of heart apical window to parasternal window. Rotating is spinning the transducer around its axis. This image shows rotation of the transducer from 11 to 2 o'clock, switching from long to short axis view of the heart. Rocking the cut plane allows extending the field of view in one direction or another. For example, cephalic versus caudal, or right versus left. Rocking always refers to motion in the same plane. It may be compared to the pitch of a boat. Tilting refers to motion that is perpendicular to rocking. For example, in the parasternal short axis view, tilting the cut plane allows imaging from the base to the apex of the heart. It may be compared to the roll of a boat. This slide shows compression being used for subcostal view. When doing this manipulation, always consider the patient's discomfort level. This is the end. Thank you for your attention. As this e-learning is submitted to a continuous process of improvement, do not hesitate to send your comments in to the email address.